Hi, it's Colleen Brown here, and today I am speaking on the battle that many parents face, and that is the decision to use a pacifier or thumb sucking, or allow their baby to thumb suck, and what is the healthier alternative, and that's what I'm going to be sharing today. So to start with, I want to show you some examples of pacifiers that my grandson has recently used. He's 6 months now, and that is this kind, and he didn't really like this one all that much, but he used it a little bit, and then we switched over to this one, and he actually liked that one much better. So I'm going to start with what are the benefits of pacifiers. Pacifiers can satisfy your baby's need for non-nutritive sucking, or NNS as it's known in the medical field. Sucking is a normal infant reflex. All babies have a need to suck, but the amount of sucking varies from baby to baby, obviously. So many babies, the urge to suck seems to be more than what's needed for nourishment, and many babies want to suck when they are tired, bored, or in need of comfort. If your baby wants to suck beyond what nursing or bottle feeding provides, a pacifier may satisfy that need. Pacifiers often help babies go to sleep. Many babies like to suck as they drift off to sleep, and sucking is a self-comforting behavior, so a lot of times the pacifier helps stimulate the sucking. And another one, a pacifier may reduce the risk of overfeeding a bottle-fed baby. The urge to suck for comfort is often mistaken for a sign of hunger for both bottle-fed and breastfed babies. This misunderstanding is not of concern for breastfed babies, as they can control the flow of milk while breastfeeding. However, young babies cannot control the flow of milk from a bottle in the same way. So the risk of overfeeding is greater when a baby is fed from a bottle. And bottle-fed babies with an already full tummy may end up overfed, with gas bubbles and spitting up soon to follow if they are offered further feeding too soon. Reducing the risk of overfeeding in a bottle-fed baby is where a pacifier can come into play. And the most important, I feel, benefit is that a pacifier is a lot easier. You can take a pacifier away. You cannot take a thumb away. Many parents worry about thumb sucking becoming a habit that may be difficult to break in the future, and may opt for pacifier in preference. One advantage, like I said, is that you can take a pacifier away, but you cannot take the thumb away. According to Jane Soxman, a doctor of dentistry, and author of the study and diplomat of the American Board of Pediatric Dentistry, she says, contrary to popular belief, there are some positive effects that result from sucking on pacifiers. One is that they assist in reducing the incidence of SIDS, or sudden infant death syndrome. Babies who are offered a pacifier do not sleep as deeply as those who sleep without a pacifier. Pacifier sucking makes it possible for the infant to be aroused from a deep sleep that could result in the stopping of breathing. Pacifiers also increase sucking satisfaction and provide a source of comfort to infants. Now, let's go into the side effects of thumb sucking. According to the Palo Alto Medical Foundation for Healthcare Research and Education, thumb sucking is normal and soothing in babies and young children. Thumb sucking can be the result of hunger, boredom, nervousness, or tiredness. Most children do stop sucking their thumbs between the ages of 3 and 6. For children who continue to suck their thumbs as their permanent teeth are beginning to come in, there are possible negative side effects. Dental problems being one of the biggest. Dental problems can occur from extended thumb sucking. A child's teeth may not align properly, or malocclusion, or the teeth may be pushed outward, causing an overbite. The roof of the mouth may become malformed. Depending on the severity of these issues, treatment from an orthodontist may be needed. Speech difficulties. Speech difficulties are a possible side effect of thumb sucking that continues after the permanent teeth are appearing. Teeth alignment problems cause certain sounds distortions, according to speechpathology.com. Additionally, long-term thumb sucking may slow the replacement of tongue thrust, a normal early childhood swallowing pattern, with the mature swallow. The sounds and letter that may be impacted include S, Z, T, D, L, and E, and DZ. A lisp may also be an effect of thumb sucking that extends into the school years. So, with all this said, what do the greatest well-known experts say? Dr. Spock himself was a proponent of pacifier use, but only for a short period of time, and only as a means of avoiding thumb sucking. In Dr. Spock on Parenting, he advised parents to use the pacifier only until age 3 or 4 months. At that point, he said, the sucking reflex weakens naturally, and weaning from the pacifier is easy. In his book Touchpoints, Dr. T. Barry Brazelton explains that thumb sucking after toddlerhood is a symptom of deeper issue. Instead of trying to fix the symptom, Dr. Brazelton suggests doing some research to find the root of the problem. So, I have always believed, personally, from raising 3 children of my own and now my grandson, a pacifier is a much better alternative than thumb sucking. You can take a pacifier away, never to be seen again, but unfortunately, the same is not true for the thumb. The problems that thumb sucking can cause is just not worth the soothing that an infant needs for such a short time.